Hello, everyone, and welcome back to my podcast, Nutrition Rewired. Today, I am joined by Dr. Navaz Habib, and we are talking about a fascinating topic, the vagus nerve. And there is no better person to have here today than Dr. Habib. So, thank you for joining us, and it's so great to have you.
It's an honor and pleasure to be here with you.
Yeah, so I'm ready to dive in. I'm not even going to waste your time because we were even just chatting a little bit off air, and he was sharing with me some specific tools that I'm really excited to bring to my listeners, and there's just so much to cover. So let's start with what the vagus nerve actually is.
Yeah, it's a great question. It's obviously the place to start because most people don't know what it is and nearly how important this nerve is to the body. It stuck out to me because it was a unique nerve compared to all of the other nerves and connections in the body. It is, and we call it we tend to say the vagus nerve. There's two of them. We have one on each side, right side and left side. And they come out of the brainstem. They're actually a cranial nerve. So we have 12 pairs of cranial nerves, meaning that these are nerves that send information to the head, neck, face area. And they tend to do all of the important facial expressions, taste, sight, smell, all of those important senses that we have in and around the head and face area. The vagus nerve is the 10th of those 12 pairs, and it comes off the brainstem and it goes to a couple of areas in the head and neck area, most particularly a little bit to the ear, skin on the ear. It sends some motor signals to muscles in the neck, but then this is the only nerve that does this. It comes down through the neck and it essentially innervates every visceral organ that we have in our entire body. So it has a direct connection to the heart, to the lungs, all the way down the esophagus, to the stomach, to the small intestine, to the pancreas, to the liver. Every organ that we have has a direct connection to the vagus nerve, except for a couple of small ones. But no other nerve in the body does anything like this. This is a very unique functioning nerve. And it's so important to understand because the research over the last 20 or 30 years has really shown a light on this particular nerve and why it is unique and why it's there to actually be the connecting point that allows us to thrive as humans. It keeps us able to handle emergency stressful situations and be able to shift back to a state where we can rest, digest, and recover. And it does that through the parasympathetic nervous system. So let's do a little rewind here just to understand. So the vagus nerve is the 10th cranial nerve, but it's a component of a very important system, which is called the autonomic nervous system. The autonomic nervous system controls all of the automatic processes that occur within our body that I don't have to consciously think about. So I'm not consciously thinking about digesting my lunch. I'm not consciously thinking about every breath that I'm taking or beating my heart or sending out digestive enzymes from my pancreas or whatnot. All of those processes are happening on their own automatically. And the signals that need to go to those organs to continue those functions and to tell the brain what's actually happening in all of those organs run through this autonomic nervous system. And there's two parts to the autonomic nervous system. We have the sympathetic branch, which is kind of the fight or flight. So it keeps us on high alert, ensuring that any stressors, any traumas, any threats to our survival, that we can respond accordingly and send information to the right areas so that we can either fight, so sending blood flow to the muscles, or to the legs where we can run away. So fight or flight is really this thought process behind the sympathetic nervous system. The opposite side of this is the parasympathetic nervous system. And the parasympathetic nervous system runs the what we call rest and digest. I'm going to add recover because this is where the recovery occurs. You can think of it very simply as the sympathetic system is more like the accelerator of a car, making the car move, making the car go. It's driving us towards something or allowing us to complete a goal, where the brakes is the parasympathetic nervous system. And a major function of the vagus nerve is sending that parasympathetic information out. So essentially, the majority of the brake line in the body is the vagus nerve. And so when you can imagine if the vagus nerve is not functional, if it's been put through the ringer, it's not going to be able to send these important rest, digest, recover pieces of information out to all of those organs. And it then forces us into a state where we're more in that fight or flight more often. And that's problematic for our overall function. So I know I got a little deep there and went a little on my normal tangents as I usually do, but the vagus nerve is important because it is the brake line for the body. And the signals that it's sending is not just to those organs, but particular cells within those organs. It's the immune system. And we've thought about the immune system very much as just being this protective mechanism of the body. It's misunderstood. The immune system is actually there to help build and maintain the optimal function of each organ. And the vagus nerve signals to those cells to ensure that the optimal function of each of those organs happens without any issues. So we can recover from the stressors that inevitably do pop up every single day.
Wow. Very helpful overview, especially because I think a lot of people don't, we think of you're either really stressed or you're not really stressed. And we think, oh, if you're stressed, it's bad. We think of all stress as maybe being negative. And the way that you just described it, even the sense of referring to a vehicle, right? Well, you want to go, right? You want to go to whatever destination, but if you don't have brakes, that's terrifying, right? That's
Yeah, and
terrifying.
that's exactly right.
We end up in an accident. So, and wow, just to think about, how many different organs are being innervated by this nerve. Well, if we just think of that, I mean, how many different outcomes can occur in terms of dysfunction with this nerve if it's going to innervate the gut, the pancreas, the lungs, the heart. I've seen research on vagus nerve with cardiovascular health, immune function. So it sounds like there's so many areas where things can go wrong with our health.
That's exactly right. You mentioned stress earlier, and I just want to circle back to that because you're exactly right. There are different types of stress, good stress and bad stress. This is something that I learned about a long time ago from Tim Ferriss, where he literally broke down eustress,
Yep.
EU stress, and negative stress being distress. EU stress is good stress,
Mhm.
and distress is bad stress. I simplified it down in my book to just kind of how I see it is eustress is any stressor that moves you closer to achieving a particular goal, and
Mhm.
distress is any stressor that pushes you away from or keeps you away from achieving a goal. So it slows your progress down. Stress is going to happen. We're going to have good stressors, bad stressors. It's the idea of exercise. Exercise is generally eustress. But
Mhm.
if your body is completely depleted, not doing well, in need of recovery, that exercise can act as distress to your body
Mhm.
and push you over the edge. We need to essentially be able to figure out the balance point of stress. And if we're spending too much time where stress is driving our autonomic nervous system towards that sympathetic state, then it's burning out the parasympathetic nervous system. It's burning out the vagus nerve. And that is what causes the vagus nerve to become dysfunctional. And
Mhm.
each person's going to have a different threshold, a different level of the amount of stress that they can handle. They're going to have different self-coping capabilities. They're even going to have different sources of stress. And we often, when we think of stress, we think of like psychological daily stress, my kids screaming in the back, finances, car, this, that. We forget about important other areas. And so there's four areas that I've broken it down to. We have biochemical stressors, which we overlook really significantly. This is biochemical stressors in a negative light are either too much of a bad thing or too little of a good thing. So are you getting your macros in a good quantity? Do you get enough protein in? Do you have enough fat, or are you having too much carbohydrates? Right? What's happening with your dietary intake? What about micronutrients? Are you getting enough B vitamins? Are you getting enough of the vitamin C, vitamin D, all of that whole the alphabet soup of vitamins? Are you getting the correct amount? Sometimes you might be getting too much. What about on the toxins side? Is there lipopolysaccharide that's making its way in because you have microbial dysbiosis in your gut and your microbiome is dysfunctional, and that is leading to a breakdown of the gut lining and you're getting these toxins in. Or maybe you had a tick bite and you might actually have like a Lyme disease type of situation. That's a biochemical stressor. So we have to look at the biochemical stress, and that's really where holistic nutrition, that's where functional medicine really is very good at pointing the flashlight and saying this is the biochemical source stress that we need to look at. We're often very good at forgetting the other stressors as well. So biochemical stress is number one. Number two, physical stress. This one I think is overlooked way more than it should be. So this is, are we sitting too much?
Mm.
Right? Are we victim of like a car accident and had some sort of traumatic injury, slip and fall injuries, um, muscle quality, which plays into the biochemical stress, but it's also your ability to move, your ability to function. What's your endurance? What are those physical challenges? What even something as simple as posture, right? Like if you're in this slouch, terrible on my cell phone position all the time, you're physically stressing your lungs to not be able to expand and contract and get the air in effectively. Breathing is such a huge piece to this. The breath is actually the main way to address and optimize vagus nerve function. But physical stress of postural dysfunction decreases your ability to breathe. So we need to
Mm-hmm.
look at that as well. The other two are the daily stressors, and these are kind of the day-to-day stressors that we mentioned earlier, the finances, the kids screaming, the this and that, the day-to-day stress that we tend to call stress. And then the last one is psychological. And this is really looking at events that occurred in your past or in your childhood or at some point during your life that scuff the lens through which you see the world and really changes how you perceive the world affecting you. And so psychological stressors can be things like victim of a crime, feeling like the victim of some sort of car accident or something along those lines, how you perceive those moments. Um, Sadly, like loss of a parent, loss of a child, loss of a loved one, um, sexual abuse, things like that, right? We know that there are major events that occur, and we know that the effect of those psychological stressors and the effect that they'll have down the road will affect your perception of other stressors or other environmental things, just objective things happening around you that you may start to take on as stressors to you, and you become the subject of that. So those four areas all need to be assessed really effectively. And when each of those four areas in some capacity increases at a rate that's greater than the body can handle, then over time we break down the ability to handle that stress.
Mm-hmm.
And that's where vagus nerve dysfunction kicks in. So those four areas of stress, I recommend each person really do a good self inventory of your stress levels in each area. Get to know what's happening with your microbiome, doing gut testing, get to know what's happening with organic acids, getting to know what's happening with nutrient levels, things like that. On the physical stress, check to see, are you moving enough? What's going on with muscle quality? What's going on with posture? Becoming aware of these things, becoming mindful of how your body is responding, looking at past traumas, and then looking at your day-to-day stressors and how you are coping with those and how you are handling stress. I think that is a very, very powerful tool because regardless of where you're starting, think of it this way, a really simple analogy. A GPS, if you take out your phone, you grab Google Maps, and you're like, okay, I want to go to this restaurant. There's two pieces of information that Google Maps needs. You put the name of the restaurant in, but it has to know where you're starting. Otherwise, the possibilities to get to that restaurant are infinite. But once it knows where you're starting, if you have your starting point, then and you have a goal point, then you can figure out the path to get there. And there's people and support networks like Aaron, like myself, like that we are out there to help create that path and make that path simpler to get to the goal. But none of
Mm-hmm.
that matters if you don't know where you're starting.
Mm-hmm. That's very true. Yeah, and we love all those different testing here at Nutrition Rewired, and I like when you're saying all of this, and the way that I like to describe it to clients is almost in the form of a bucket, right? You've got this
Yes.
bucket, and you've got different levels of stress that are, in this bucket. And so, the way that Dr. Navaz has just kind of highlighted the many things that you put in that bucket This is when clients come to me and maybe they're running a marathon, or they're wanting to know, should I try intermittent fasting, or all these different things. Okay, there you go in your book, the bucket. So
Yep.
what does your bucket look like? And this is where, when clients are like, I'm gonna want to train for a marathon, what do you think? And I'm like, well, let's take a look at your stress bucket, right? Because like you said, physical activity is a form of stress on the body, can be a eustress, but in certain cases, depending on the client's stress load or their bucket, it can be a negative stress for them. So I think it's very important to be able to think holistically, the way that you just described it, for clients to understand that stress isn't just the kids screaming, the finances, the stress that we tend to just kind of go straight to when we think of what that looks like.
Yeah, that's exactly right. I couldn't have said it any better. And that bucket analogy is exactly the one that I utilize, right?
I
Each
love it.
person has a different size bucket. Everybody has
Hmm.
different coping mechanisms by which the bucket can leak out at the bottom and
Hmm.
not overflow as quickly. But we need to do that assessment to figure out how full that bucket is on each
Right.
individual. And there's nothing better than knowing individually where you currently stand
Hmm.
and then being able to determine how much more can I take on.
Right. Excellent. Now, what are some of the symptoms that someone's dealing with vagus nerve dysfunction? And I know this is a very loaded question, especially considering how many different areas of the body this nerve innervates. But are there some big ones that you maybe see in practice or through your research that you've come across?
Yeah, the main one that really sticks out to me. So I'm glad to hear that a lot of people are utilizing wearable health tech and tools like Aura Ring, Whoop Band, Apple Watch, Garmin, Fitbit. They all have these wonderful sensors in there, giving us an indication of what our heart rate is currently at, our HRV, our sleep scores, all those things. The number one sign of vagus nerve health and where you're at is called heart rate variability. We'll get into what that means in a second, but if we just simply want to take an assessment of where you are right at this exact moment, the easiest one to look at is your heart rate. So your heart rate is the number of beats of your heart in a 60-second span, 1 minute, right? So we don't want your heart to be beating when you're in a rested state. We don't want it to be beating excessively. We don't want to have a heart rate of 80, 90, 100 beats per minute just while I'm sitting here in my office chair. I want to be able to be in a calm, restful state. I want to see that my resting heart rate is sitting between 50 and 65 beats per minute in an optimal sense. Okay. That should be very similar to your overnight heart rate. That's a very basic way of looking at your autonomic function because your sympathetics, your accelerator, pushes your heart rate up, while your parasympathetics, your vagus nerve, brings your heart rate down. And so we want to stay in a lower, healthy heart rate, telling us that the vagus nerve signaling to the heart is good and effective. Now, if we want to go a level deeper than this, heart rate variability is the marker that we then go and look at. So heart rate variability does not look at the number of beats of your heart. It looks at the number of milliseconds between beats of the heart averaged over a period of time. Okay. So your heart rate variability is going to be determined by how variable the time is between beats of the heart successively over that time. So let's say, for example, we've got two heartbeats, and between them, we're sitting at 700 milliseconds of time between them. The next two beats, we've got 750 milliseconds. And the next two beats, it's 650 milliseconds. Okay. This is a very simplified example, but what we're seeing is that the lowest level is 650. Okay. The lowest number of milliseconds is 650, 700, and then 750 being the highest. What we're seeing is variability. We're seeing that it's not a metronome. It's not happening in entirely a rhythmic fashion. And that's actually contrary to what most people would believe, that we want our heart to beat like a metronome. We don't. We want our heart to beat in a dynamic fashion because that's telling us that we are resilient. We're resilient in that we're able to push the accelerator when we need to and push the brakes when we need to. So we can speed up the heart rate and bring our beats closer together as necessary. And then we can slow it down, push the brakes, and separate those beats as necessary. And that's what we want to create. So the higher the heart rate variability on average, the better we have a sign that we have balance between the sympathetic and the parasympathetic inputs to the heart. And that tells us to a much greater degree how resilient the body is and how well the vagus nerve is functioning. So that's going to be my number one kind of look at if things are working well. Now, I'm sure we want to dig into this a little bit before we get into the next area, which is going to be more inflammation, and understand how inflammation is processed and controlled through the vagus nerve. But if you have any questions about the HRV part, we should probably jump in there first.
Yeah, I mean, I think it's just so many people are getting this value on these wearables and they're saying, oh, like my recovery is great, but they don't understand the things that influence the HRV. And, as a dietitian, I'm always talking about food a lot and, are you eating enough to recover, an anti-inflammatory diet, all that stuff. And obviously sleep goes into it. A lot of people know that, or like physical activity aspect, but are there other things that play into HRV that maybe I haven't mentioned in terms of those kind of main lifestyle or dietary factors that you can speak to?
The main one, the single strongest factor that drives your heart rate variability is your breath.
Mm,
And it's
wow.
not depth of your breath, it's actually the rate of your breath. And so it's not breath rate in terms of breaths per minute, but it's as we breathe in and inhale into our lungs, we're actually pushing the accelerator. Okay. Think of it this way in a practical sense. If you're driving and somebody comes and honks and cuts you off, what's the first reaction? It's going to be take a breath in and get your eyes to open wide, get into a sympathetic fight or flight state to know how to create an evasive maneuver, get away from that threat to my survival, right? That inhale is a direct sign to your heart and to your brain to turn off the vagus nerve right now because we need to be in a fight or flight state immediately. But inhaling does that. But let's think of it in another practical sense. When you're feeling calm and you need a moment, we all have this saying, just take a deep breath or take a breath, right?
Mhm.
Step away from it for a moment, go and take a few breaths. And as we exhale, we sigh and we go, ah, and that calming feeling is literally the shift from sympathetic into parasympathetic, into
Mm.
turning on the vagus nerve. And what it does is it then spreads the heartbeat out. And so the breath, as we inhale and exhale, if we're inhaling for too long or exhaling for too short, that's pushing us more so into a sympathetic state. And most of us aren't breathing effectively to begin with. Our breath should be nasal through our nose. It should be diaphragmatic, which means we're using our belly to breathe, which comes into digestion. We'll talk about that in a second. And then lastly, it should be longer exhales. Most of us are really good at just going and then breathing it out and being done with that exhale. And we take a longer time in inhale. What that does is it drives us into a sympathetic state. And that's what we need to avoid. We need to learn to breathe really, really effectively. And as we breathe more effectively, we're sending more signals to stay in that parasympathetic state more readily. The best example of this is look at some really high performing athletes, right? Right before they go to perform their major activity, they're often going to take a good deep breath and exhale as they are going into that moment, right? So let's say, for example, I'm a big baseball fan. So Shohei Ohtani is obviously a generational talent. The guy is doing unreal things. And he gets up to bat and he stops and he's going to exhale as the pitcher is throwing the ball. And then he's going to swing at the bottom of the exhale when he's in his most parasympathetic state to be able to perform the task at hand, but control his bodily functions and get into a resilient state. And
Mhm.
that recovery piece is a great thing. Another kind of tool or another example of this is any elite athletes following the performance of their activity often will recover in an ice bath. That ice bath is a driver literally to slow their heart down, to get their breath rate into a much more calm state. They go into a stressful scenario being in the ice bath, but they're using that tool to teach their breath or to utilize their breath to train them to come back to parasympathetic. And
Mm.
as we train to become parasympathetic, it's through the control of that breath, particularly nasal, diaphragmatic, longer exhales.
Mm.
Those three things need to happen. And the reason the diaphragmatic thing links into digestion is we often think of the diaphragm as just being this muscle that creates the breath in. It allows for the vacuum of air to come into the lungs. But just below the diaphragm is where the stomach and the liver and the spleen and the uh, intestinal tract all lie. And as we do those inhales with our diaphragm and we actually utilize our diaphragm, we're actually creating a motion pattern of massage and calm and stimulus in the abdominal viscera, in those organs that are below the diaphragm. The diaphragm is not just for the lungs, it does so much more. And so a calm diaphragmatic breath is actually a signal to those organs to go back into that rest, digest, and recover mode. And that is completely overlooked. So the breath is by far the single most important tool by which we can shift our state. We can go into a rapid, quick oral breath with no diaphragm, and we can go into, and I'm kind of doing this on purpose, where I'm speeding up my talking, I'm speeding up all the things, and that's me pushing the accelerator. And then we can bring it gently with a slow, calm breath back to parasympathetic. And
Mm.
that breath control is the major driver by which we can determine, are we in sympathetic or parasympathetic?
Wow. And so everybody listening, I mean, as you said, you'll often hear the term kind of thrown around, oh, just take a breath and, take a few deep breaths or focus at people just they think it's that like woo woo like goal of, oh yeah, like do some breathing, meditation. They picture like a monk sitting on the side of a mountain and it's I don't think people really understand how powerful it can be. And it's funny that you're saying this because when my husband and I first met when we were dating, I noticed he would often like sigh, like he would let out that big deep breath. And I'd always think like, geez, I'm exhausting. Like I'm exhausting to be around, I'm just like go, go, go. We're always doing stuff. Maybe he's tired of me. And then I learned like he's just really good at regulating his nervous system, and he is an example of someone who is very regulated. But talk to this a lot about with clients the aspect of digestion in the vagus nerve. So maybe we can hop there before we head into the inflammation, even though of course that still ties in. But when we see impairment of the vagus nerve, what are we going to see in terms of like gastric secretions or motility? What are some of the negative consequences digestive wise that we will see?
You've hit kind of the nail on the head with each of those. We know that there's vagal innervation directly to the stomach, and the
Mhm.
stomach is going to have decreased hydrochloric acid secretion, right? So we'll often have a hypochlorhydria type of situation where we're not able to break down our food more readily. Um, Bowel motility time or gut motility time is going to change significantly. So I have a great little test in the book called the bowel transit time test, which is a great way to assess what's going on with digestion. And we want to be in a certain bracket. We want to be kind of in that 14 to 24-hour window where
Mhm.
it's optimal. And if we're too fast or too slow, it's a sign that we don't have enough vagal signal going to the entirety of the digestive tract. It's not a direct sign, but it's a great kind of secondary look at gut function. So
And a great non-invasive tool as well.
exactly, right? Like for 20 cents of white sesame seeds
Yep.
and a glass of water and marking down your times, if you could
Mhm.
assess how well your gut is functioning, I think that's a pretty very positive way to look into something because we know how much functional lab tests cost
Mhm.
outside
Mhm.
of this. The next thing we're going to see is a lack of digestive enzymes being secreted, not just from the pancreas, obviously, all of the digestive enzymes, the lipases, the proteases, the amylases that need to come out of the digestive into the digestive tract from the pancreas are not going to be released at a very high level. So we'll often find undigested food in the stools, or we'll see that there's excess bile, things like that.
Mhm.
Um, Gallbladder, really huge. This is a big one. How many of your patients have had their gallbladder removed?
Like
It's
at
insane.
least
Probably
30%.
50%. Yeah.
Yeah.
And we just now have this, like, I'm not even sure how the medical system came up with this, but why would we have this sack of bile just sitting there? What reason does it have to be there? Well, bile is really important in helping digest fat, but it's also necessary in the release of toxins from the body.
Hmm.
And if we don't have a good functional gallbladder, it's a sign that we don't have vagal nerve signals going in and creating that contractile response, pushing the bile into the digestive tract. When we have a cholecystectomy or if we have gallstones, it's almost a direct sign and usually one of the first signs that I find of vagus nerve dysfunction. No
Wow.
question about it. It's so important because that contractile response in the smooth muscles of the gallbladder is a direct link to the acetylcholine that's being released from the vagus nerve. So
Mhm.
across the board, if somebody has gallbladder issue or has had it removed, it's like such an important sign that things are moving in the direction of vagus nerve dysfunction more severely. On
Yeah,
the
and then
motility side, sorry, go ahead.
no, classic with the gallbladder, I end up seeing then the SIBO tends to be it's like a it's almost like we could predict the future of a patient with starting with this dysfunction. And so anytime I put together a protocol for a client, it includes this nervous system support, and
Yeah,
people ignore it. It's
100%. And what's crazy is when you have a SIBO situation that's recurrent,
mhm,
because you keep going back with the same herbs or even a different set of herbs to try to kill it off and these prokinetics, wonderful. You're forgetting that the vagus nerve is the signal from the brain to the gut, to the enteric nervous system to actually create that peristaltic motion, to
mhm,
actually push things unidirectionally from the top to the bottom and get rid of the food, move the food effectively through the intestinal tract and move the bacteria out, get rid of the excess bacteria. And if we have that recurrent SIBO type of situation, there's a couple of areas that I would look at. I would look at the ileocecal valve
mhm,
because we know that very easily things can go backwards from the ascending colon back into the distal small intestine area. And that happens because of leakage through that ileocecal valve. Well, the ileocecal valve is made up of smooth muscle that
mhm,
requires signaling from nerves to create and maintain the tone of that valve. Every
mhm.
sphincter that we have has a requirement to have this muscle tone signal going to it. What nerve might be required for that? It's the vagus nerve. Imagine that. So the enteric nervous system can do all of these things effectively on its own, but vagus nerve signals make them work better. And so if we
Mhm.
forget about the vagus nerve, we're often going to have a recurrent digestive issue coming up. IBS, IBD, SIBO, hypochlorhydria, even GERD and kind of reflux type of situations, we have a pyloric valve there.
Mhm.
Right? Our pyloric valve is a sphincter, our
Mhm.
pyloric sphincter, excuse me. And what we need is we need tone. And the vagus nerve is the direct signaler of tone into those muscles. So vagal tone derives muscle tone. Muscle tone derives optimal function through that peristaltic and motor, the MMC through the gut. So if you want your gut to function effectively, do not ignore the vagus nerve. It is of utmost importance.
Excellent. We don't need any more than that. We just need everyone to like if you take nothing away from the episode, that is it. So inflammation, inflammation, immune system, what would you highlight there in terms of the relation of the vagus nerve and what you've seen in the literature?
Yeah, inflammation is this misunderstood thing. And what inflammation is a process, and it's a necessary process in acute circumstances. So when we have lipopolysaccharide, or we get hit in the arm, or we have a bump or a bug bite or something like that, we have an influx of blood to that area to help recover the damage that's occurred or that's been inflicted on that area of the body. The problem occurs when we can't shut that inflammation off. Inflammatory control is what's often missing. And so, on that path of disease, we often have these root causes that we're looking at, right? I have this image of a tree, and on the bottom, we've got all the roots of the tree, and on the top, we have all the leaves, and we see all the leaves. And that's the diagnoses, that's the diseases or conditions that we tend to see. And we have the trunk of the tree, and that trunk goes down into the soil. And within the soil is where all the root causes pop up. And this is lifestyle specific functions, your breathing patterns, your stress management tools. Are there potential genetic effects? What's happening with mitochondrial function? What's happening with toxic inputs and all of the potential stressors that can push us into these disease states? But the trunk is a common path between the roots and those diseases. And that common path, that trunk, is uncontrolled inflammation.
Mm.
When we are unable to keep that inflammation level controlled, when we go into an acute state, be able to turn that acute state off, if we're not able to do that, then what happens is we go into a state of chronic inflammation. And chronic uncontrolled inflammation is the path to essentially every chronic disease that we have. The job of the vagus nerve is actually to signal to the immune cells present in every organ of our body. These are called tissue resident macrophages, and they have a different name in each of the organs that we have, but they all have the exact same function. And that exact function is monitor inflammatory function. And when you get a signal of acetylcholine from the vagus nerve or from other tissues, that acetylcholine is going to turn that inflammatory process off. But if you don't have good vagus nerve function, then we don't have a signal going to those macrophages to go from an inflammatory state to an anti-inflammatory state. So they stay in a state of high inflammation. And so we'll often find on blood work things like high levels of C-reactive protein or high levels of calprotectin, or even just borderline high, just like this little bit of chronic inflammation that the doctors are like, I don't know, it's not high, but it's not low.
Mm-hmm.
And it's on this borderline. And that is a direct sign that we're not getting those anti-inflammatory signals sent through the vagus nerve.
Mm-hmm.
That's important to understand. And so, what inflammation in itself is not a bad thing. It's a necessary process for us to function, for us to overcome threats to our function. But the control of inflammation is necessary. And that's the same as using the brakes in the car. It's the same as pushing our body to a rest, digest, recover state. It's not just the nerve signals, but where those nerve signals are going is the immune system cells.
Mm.
And they have every single immune system cell has a very important receptor on it called the alpha 7 nicotinic acetylcholine receptor. That receptor needs to be activated to shut down the inflammatory response. If we don't have that acetylcholine signal coming in, we're not going to be able to do that.
Mm. And in the gut, I'm assuming this is what we're talking about, the gut-associated lymphatic tissue, which we know is a very large majority of our
Yeah.
immune system for our whole bodies.
70% by volume. So
Yeah, wow.
70% of our immune cells by volume are located in that gut-associated lymphoid tissue. That's all of those Peyer's patches. That's all of the
Mm-hmm.
macrophages that are sitting underneath the epithelial lining. That's really interesting. That's where enteroendocrine cells send their GLP-1 and GIP and CCK and PYY. It comes through those cells, through those macrophages. And so the peptides that are being released actually have an effect there to tell us are we full or not. And then it's the interplay and this connection between the vagus nerve and the immune system that then tells us are we satiated or not.
Mm.
Right? So there's so many important factors here to understand that
Mm-hmm.
if vagus nerve is dysfunctional, this is the one big takeaway. If vagus nerve is dysfunctional, you're not going to get signals up to the brain that need to get there, and you're not going to be able to send these anti-inflammatory control signals back down. And that's so important to understand.
And everybody here needs that in
Period.
some way, no matter what it is, whether you have PCOS or inflammatory bowel disease, or you're just dealing with chronic inflammation or autoimmune disease. I mean, this is a tool that you all have to improve your overall well-being, and it cannot be ignored.
Yeah, vagus nerve is not condition specific at all. In fact, it is entirely just a process that single similar process by which all inflammatory root causes create
Mm-hmm.
disease if that
Mm-hmm.
is not functional.
Mm-hmm. So a lot of what, I used to see on social media was like, here's how we strengthen the vagus nerve. Here's how we make it really strong. And that wording kind of didn't make sense to me in terms of my understanding of the vagus nerve. And so can you explain why we don't necessarily want to strengthen the vagus nerve? What you referred to was toning it. Like what does that mean? And maybe what are some ways that we can improve our vagal tone that the listeners can take away? Because I think at this point everyone listening understands why it's so important, and now we just need to know what are the next steps, and obviously read your book because it's an incredible resource to really dive in, but some practical tips that people can take away.
For sure. The I agree with you. I don't think we need to strengthen the vagus nerve. I think what we need to do is create tone. And what that literally means is we need to strengthen the signals that are being passed through the vagus nerve. That means we need to get the signals to pass through the vagus nerve more effectively. It's the efficiency and the effectiveness by which signals are being passed through. What vagal tone, how we positively affect this is through a process called neuroplasticity. And neuroplasticity is a direct, it's kind of the fancy way of saying neurons that fire together wire together. And as we create practices and habits that positively affect vagal function, we increase the number of signals that are being passed through the vagus nerve, and so the tone of that nerve increases. Does that make sense?
Absolutely.
So what this means is we need to start breathing more effectively all the time. It starts with those 10-minute sessions of breath work, or just 2 to 3 minutes of finding your breath and noticing that you're not diaphragmatic, that you're not nasal, that you're not focused on those longer exhales. It's first becoming aware, and then being able to plug in these lifestyle practices and exercises that affect the breath in that particular way. Everything that I talk about, all of the exercises, all of the things in the research, you can always plug back to, is it affecting your breath? And your breath is then the driver of creating that vagal tone.
Mm-hmm. I love
Okay,
that.
so
That's great.
it all comes back to breathing really effectively. And so, yes, this can be considered like woo woo, right? Like just breathe. That's all that needs to happen. Well, 90% of people are not breathing correctly. And so that's why we have so much chronic disease. That's one of the major reasons why any of these inflammatory stressors that come into our body, all these toxins that are around us, can push us into a state of chronic disease more readily, is because we're not breathing correctly. And we need to start doing that more effectively. So the way to do that, the practices that help us get into these areas, is number one, becoming aware. I just like putting a hand on the chest, putting a hand on the belly, and taking 3 breaths and noticing, am I breathing with my chest or am I breathing with my belly? And then 3 more breaths to focus my attention, to come in through the nose, to go into the belly, and to slowly exhale. And if we can spend double the amount of time on the exhale than we do on the inhale during those practices, what we're going to do is we're going to over time train our ability to breathe effectively. We're going to train that breath pattern to occur more readily. That breath pattern then can be translated to day-to-day life. And if we do this more often and more regularly, we're creating that neuroplastic signaling in our vagus nerve, strengthening or toning that nerve more effectively to function.
So it's like, think of going to the gym. You're going in and you're training and you're doing something over time, and over time it becomes easier, right? You're lifting that 10-pound weight in a few weeks, that's 30 pounds. You're getting stronger in that, like you said, that neuroplasticity
Yeah.
perspective.
And the best analogy to this is exactly that: weight training or lifting or something along those lines. What's really cool here is we're not actually strengthening the muscle when we're doing those exercises. So let's say I'm doing bicep curls, just because they're easy for people to understand. If I'm picking up a 10-pound weight and I'm curling that, am I actually just using the muscle, or am I sending more signals through my brain to my muscle via the bicipital nerve that goes to my biceps, and toning that nerve to do a better job of signaling to the muscle, and thus getting the muscle to get stronger, get bigger, do this job more
Mm,
effectively, to the point where when I can then curl 30 pounds, it's actually a neural tone thing that's
wow.
changed, not just the muscle or not only the muscle. Yes, the muscle will reflect it in size, but that's not all we see. We only
Mm,
see that with our eyes, but we know that that curl function is much more compact, much more efficient because the exact right neurons that needed to fire to make that muscle work are working more effectively. The
mm,
exact same thing can be done through your breathing patterns for the vagus nerve.
mm. Yeah, that's wonderful. And I think what's really cool about the awareness aspect of it, because it'll give you information about maybe what some of your triggers are for different stressors, or kind of what times of day this may show up for you more than others. When I'm coaching clients, when we're working on digestion, obviously we're focusing around mealtime, right? Like I'm wanting clients to be doing this diaphragmatic breathing right before they eat. I want them to put their
Yes,
phone away. I want them to like stop looking at their emails. Just even 3 deep diaphragmatic breaths is all I can ask for at the beginning. But what you said about the awareness, for other people, there might be situations where you're in an argument with a boss or a friend, and or maybe you're even when you're exercising, being aware of how you're holding your breath. So just trying to pay attention to all of the different areas in the bucket that we talked about, and those types of things of maybe what are going to be bigger triggers for you. I don't know if you would agree with that as kind of a good starting place.
100%. Awareness is key. Putting your time and your effort and your mind,
Hmm.
your awareness to how things are currently going, and then actively creating patterns and choices to address those in a very positive way, to
Hmm.
to try to adjust more readily, and not getting discouraged when it doesn't happen automatically, not getting discouraged when after 2 weeks you notice that your breath is still not ideally shifted. You've been breathing poorly for 40, 50 years. Like 2 weeks is not going to change much, right? We need
Mm,
to give patience and have a realistic timeline to how long it's going to take for real
mm,
change to occur. But inevitably, if you do these practices effectively and correctly, you will over time create positive change.
mm.
No question.
I'm like, what a refreshing conversation, like we get on so many of these episodes and we talk about yeast overgrowth, or we talk about, certain nutrient deficiencies or autoimmune disease. And like this is hopefully such a refreshing, conversation for people, because we're talking about a tool that we all have. We're talking about something that is free. Like breathing is free.
Mhm.
And the power of what this practice means for each and every one of you. I just hope that, Dr. Navaz being here today can inspire each and every one of you with his knowledge. And I mean, I'm even excited just thinking about it. So
I love it. It
yeah.
all does come down to the breath. There's no
Mhm.
question. That said, there's things we can pile on top of the breath.
Sure.
Humming, chanting, gargling, singing, phenomenal tools.
Hmm.
Cold showers, wonderful. You want to
Hmm.
go for it? Do cryotherapy or cold plunges,
Hmm.
wonderful. Sauna therapy. All of these stress your breath. And if you can do it in a very positive, effective way and become mindful of your breath in those scenarios, you're actually going to accelerate the process by which these changes occur. I
Hmm.
get into all of those in the book. I dig into the science behind essentially every one of those exercises, and that's really powerful.
Hmm.
And then in certain cases, I think there's a need for greater support. And sometimes that greater support can be done in a therapeutic manner. And that therapeutic tool that I really like is vagus nerve stimulation. Now,
Hmm.
this is now kind of becoming a little bit more mainstream. People are becoming aware of the fact that there are these electrical vagus nerve stimulators, some that you can put on your ear, some that you can put on your neck, some that are just kind of biofeedback tools that vibrate, like the Apollo Neuro on your wrist or the Sensate on your chest. Or these are great tools, or tools like the True Vega, which you can stimulate the vagus nerve directly through electrical stimulation on the neck, or
Hmm.
the Dolphin or TVNS NeuroSim tools that are all there for the ear. They all have a positive effect, but they all need to be done in a manner where it's paired to your breathing patterns in order to hack that neuroplasticity tool.
Hmm.
They all need to be done in a state that pushes you towards parasympathetic, so that even when you don't have the tool available, you can still utilize your breath more effectively to get you into that parasympathetic state
Mm,
when you need it. So
interesting.
I'm a fan of all of these tools. I think they all have a positive place and a very positive therapeutic tool that they are providing. And some of them, like for example, this particular cervical vagus nerve stimulator, has been shown to have cognitive improvements, like increasing the speed by which people are able to learn, or um,
Wow.
amazing effects in acute migraine and cluster headache. And I've seen a lot of positive changes in Parkinson's and digestive dysfunction and IBS and IBD. It can accelerate that process. And that's something that's wonderful that we can have access to if the funds are available and you're willing to invest in that tool.
Mm,
But I always, without a doubt, in every protocol that I provide to my client, always will pair it with the breathing exercises all the time.
that's wonderful. So we're talking about these tools that I've actually never heard of that can do this vagal tone, I guess, exercises or stimulation in some way, it sounds like.
They're actually electrically stimulating the nerve, getting the nerve to
Wow.
work more efficiently. And it's, I think the best way to put it is they're just supercharging the effect of the parasympathetic exercises.
Wow. That's awesome. Well, very cool. Well, that's something that I need to learn more about because it's an area of which you have enlightened me. So thank you for that. And for the listeners, I'm sure as well. Now, Dr. Navaz, where can people find you? What is the name of your book? Where can people purchase it? And is there any new exciting research that you're fired up about? Just because I know you're really deep in the trenches here.
I am. So the book is Upgrade Your Vagus Nerve.
Mhm.
Came out earlier this year. It's done a lot of great positive reviews so far. So if you're really interested in the topic, you want to understand it a little bit more, then the depth is definitely there. And you can find me online, healthupgraded.com. You can join our 10-day Vagus Nerve Jumpstart, which is literally an email a day for 10 days that gives you a little heads up on a little exercise or tool that you can utilize to get you upgrading. And I'm in the process of creating my Upgrade Your Vagus Nerve course. So if you really want to dig in, we have access to that. So join the 10-day jumpstart, and then you'll get access to the course near the end. Okay.
Awesome. What great
And
resources.
yeah, yeah, my pleasure. And then you can follow me on Instagram, Dr. Navaz Habib, and tons of resources that pop up there as well.
Wonderful. Well, thank you, Dr. Navaz Habib, for joining us, and hopefully we'll talk again soon. Such a great conversation.
Sounds great. Thanks, Aaron.
All right. Bye bye.